Peace, peace. Welcome to Mama Living Healthy. I'm Tymay, and this is our special guest, Carla.
Hi, nice to meet you.
To meet you as well. This is my segment, So Boo, and today we will be talking about women's health. So my first question to you is, what inspired you to be a doctor?
I think that ever since I was young, I was always, not to sound cliche or anything, but always inclined to helping people, teaching people. I had maybe one or two family members that were in the medical field and served as an example growing up. But as I, grew older and learned more about what there was out there, I kind of just that was what attracted me. I knew that I wanted to be in the medical field, and I also really enjoyed teaching as well. And I felt like becoming a doctor was a great way to do both.
That's wonderful.
Mm-hmm.
So what kind of birth did you have for your children, and would you do it again?
My first birth for my daughter was a hospital birth. I was actually still in residency when I had her, and it was just the easiest thing for me to do. I didn't really have much time to even think about home birth or birth center or anything like that. It was kind of just what was working for me at that moment. So hospital birth with my daughter, and then I was pregnant with my son during residency as well, but by the time I was ready to give birth, I had finished residency, and I had already done a lot of research and thinking about other options, and I had a home birth for him.
With those two experiences, given saying you had like another child, would you prefer to do one over the other, or which just would be like whatever comes for you at that time?
I think that no doubt, as long as I still have the means to do so, most definitely another home birth.
Okay.
Mm-hmm.
My next question would be, what hygiene tips could you give for women?
Hygiene tips, I would say a lot of women are under the impression that they need extra care in terms of vaginal health and vulvar health, and really you don't need special soaps. You don't need, to wash on the inside. You don't need to use perfumes and wipes and all of these different things. There's so many products that are aimed at vaginal health and the smell and this and that, and really women should know that all of that is not necessary, and most of the time they do more harm than good. So we say, I know it's hard to kind of stomach it because we're also used to using all these different soaps and things, but plain water is actually the best thing that you can use for optimal health, to keep the bacteria that's supposed to be there balanced and keep your pH balanced and all of that. So the best thing is plain water. And if you do feel so inclined to use soap, then choose something that's mild. Something that doesn't have any fragrance would be the best. But really, keeping it really simple is the best way to go.
How can women educate themselves on their anatomy? It seems it's really apparent that a lot of people don't even know what it looks like. So what would you recommend?
Well, I would say two things. A lot of times Google isn't your friend, but I think in this case, Google can be your friend, actually looking up pictures, and you would definitely want to use a credible source for the description of the anatomy, because I've seen plenty of pictures that are described in a way that aren't quite accurate. So I would say a reputable source, look it up online, you can see what's there, and then a mirror. Look down there and just get familiar with what your anatomy looks like and compare. And also keep in mind that no two vulvas look alike, and just because what you see down there doesn't look exactly like pictures that you're seeing online, it doesn't mean that there's anything abnormal or anything wrong. Vulvas come in so many different shapes and sizes, and it's all a perfect, normal anatomy, just varies from person to person.
Okay, I wanted to kind of add on that a little bit. After giving birth, whether it's like a regular, like in the hospital, or a home birth and things like that, how common is it for people to have like scar tissue in their on their vagina?
So it's common, but I would say that it happens. It does happen, but the percentage is not that high. I mean, I see women postpartum all the time, and generally, if they tear or if they have, unfortunately, if they get an episiotomy or something like that, which requires suturing and whatnot, sometimes the healing takes some time. And you can have some residual scar tissue that takes some time for give me 1 second. That takes some time for that to heal, I'm sorry. But usually, as long as you don't have any tears, or the tears are minimal, and then there's usually not much residual scar tissue. My firstborn here.
Oh, hello.
Go with grandma. Yeah.
I have a personal question. And I had a home water birth, and I had a second degree tear, and I was given the option to not have stitches, so I didn't have stitches. And I guess the way it healed kind of confused me a little bit, because I'm like, oh, okay. So I Googled, and basically with tearing, obviously, in letting it heal on its own, there will be some sort of scar tissue. I was told maybe pelvic floor exercises be a good thing, as far as getting it back to, I guess, not normal, but
healing and
having a healthy pelvic floor. Have you do you ever recommend like clients to pelvic floor specialists or things like that?
I do recommend, particularly if a woman is experiencing leakage and things like that postpartum. That does happen, bladder leaks, even anal incontinence and things like that can happen. It's also not very common, but here and there I've seen patients who have issues with that. So I would refer it in that instance. Unfortunately, it's not something that we do so commonly, but I think it should definitely be something that we offer patients more, because a lot of women do struggle with those issues afterwards. So it's important.
Okay. My next question would be, do you believe in home remedies?
I believe 100% in home remedies. I used a couple, but thankfully not many were necessary for me postpartum. Actually, thankfully, I healed pretty well. But yeah, I definitely do believe in that. I used herbal sitz baths and things like that postpartum, and they were quite helpful.
Okay.
Yep.
Well, adding to that as well, with the whole sitz bath and stuff, how long did you do that postpartum?
Thankfully, I didn't have to do it for long. I didn't suffer any tears with my second birth, with my first, I had a small first degree tear, which they put one or two stitches, and that healed pretty well. And I really didn't have any issues afterward. And thankfully, with my son, my second birth, I didn't have any tears. So I used it more for the bit of swelling that I had afterward, which it was minimal, but it did help and soothe and help me feel better. So by day 2, I was good. So didn't use it for too long.
Okay. Well, that's great.
Yeah.
There is a remedy that a lot of I guess midwives and doulas use, and they're like pad popsicles.
Oh yes, I did use that. As well. Yes. That was a recommendation from my midwife also. She told me to use witch hazel, have these popsicles, ready padsicles, and I did use those as well. But thankfully, again, only had to use it like the day of and the next day, and after that I was good to go.
Okay, so those would be like fine to use, if someone had to use them for like a longer period of time, basically.
Yeah, for sure. Like, just to be on the safe side, everyone, should consult with whoever's helping them with their pregnancy, postpartum, whether it be a midwife or doctor. You can always run it by them, but generally that should be safe.
Okay.
Well,
that's that's great. I've also seen what's it called? Like breast checks that people have like little grids online. Would you say that that's good to follow, or if you like just are genuinely concerned, you should just go see your doctor instead?
I'm sorry, you see what kind of checks online?
Breast checks, like checking for like lumps and things like that.
I would say that you should always, we always recommend that you be familiar with what your breasts feel like and examine yourself. And definitely, if you're aware of what your breasts usually feel like, you will notice, if there's something abnormal. So I would recommend that you do examine yourself periodically, but for sure, if there's something concerning, then you can always go to your provider and they should check it out as well. Yeah.
I do just have one more personal question.
Yeah, sure.
I'm not sure if personally it was because of the tear, I was in a car accident during my pregnancy.
Oh my gosh.
So I was about 6 months pregnant, and I already had a back injury due to a car accident. So it was just like, it kind of made it like stronger, I guess, back pain. But it was fine until after I gave birth. And then I noticed the inconsistency and also pain from my hip down to my foot. So I'm wondering, like, could possibly like the birth have like triggered it to kind of go to that route, or would it just probably be because of those reoccurring injuries?
So it sounds like it is definitely possible that it's influenced by obviously the car accident, but during, particularly in your third trimester and after giving birth, you can have separation of the bones in your pelvis, which cause significant pain and can cause problems with your gait, walking, and whatnot. So there could be some contributing factors there as well. Pain radiating from your hip, down to your leg, that's a little extreme, I would think, to be caused by birth. It also depends what position you were in when you were birthing, because sometimes, like in a hospital setting, when you're pushing on your back and they have your legs folded up, and those positions can also cause injuries. So it kind of depends the positioning, if your pelvis was affected by birth, or just the pregnancy itself towards the end. And for sure the accident could have affected you. So that's something that you could definitely bring up to a doctor, maybe get some x-rays and some imaging and see if there's anything going on there.
I definitely did.
Mhm.
She, from what she read, she said something about me having arthritis in my hip.
Mm.
But she didn't, like, I guess, explain the rest that, was
Okay.
happening.
Okay.
And then she recommended me to do like Kegels and things like that. Um, because
Eagles for
yeah,
your hip?
for the bladder, because
For the bladder. Okay.
it was like kind of all together. Because sometimes
All.
at the time I was having pain as well,
Mm.
not to urinate, but just to sit. So I had to use
Okay.
it for a while.
Yeah.
And I think this was even after, did my daughter turn 1? It was like right before she turned 1. I was still experiencing that.
Mm.
So I was trying to figure out as far as the inconsistency, because I've been wearing like pads since I've given birth, and my daughter will be 2 in November.
You've been wearing pads because of urinary leakage? Yeah, so you definitely could use pelvic floor therapy. I would, like in your case, I would suggest that 100%. It's definitely very helpful. Yeah.
Yeah. I've been trying to find different things. I got like the Kegel weight and things like that. It to an extent it helps, it like to strengthen, and then I at that point I realized just how I guess weak those muscles are at this point. So
Yeah.
I wanted to at least get it like up here before I want to, have another child, because I
Right.
don't, have any complications or anything like that.
Right. That makes sense. I
Yeah.
agree with that.
Okay. Well, is there? I don't know. I'm more of like a nomad, so I'm trying to like see where I could find a pelvic floor specialist. Even if I guess it would have to be a virtual conversation at first.
Probably. But at least, they can instruct you as to whatever exercise it is that you can do to fortify those muscles. And I mean, what you want to avoid is definitely needing a surgical procedure to correct that, because, you're young, and you should definitely be able to, with exercises and whatnot, get that where it needs to be.
Will do.
Yeah.
Definitely. I guess my last question would be is, where can people find you?
Oh, I work out of Westchester, New York. My hospital is Montefiore New Rochelle. And if you go on their site, you should be able to find me in the directory. My name is Carla M. Williams.
Well, I appreciate you so much for taking the time out to do this interview with me, and I hope that this brings more awareness to women as far as just learning about their anatomy, and
For
just
sure.
not being afraid to just take a look and find out if you're doing okay. So
Yes, my pleasure. Thanks for having me.